This is a quick video about kneecap or patella instability. The patella can pop out of place sometimes with what seems like simple activity, other times in sports. It's usually a twisting type activity of the knee, and the patella will come out and go to the side and be caught outside momentarily and then reduce. It can come back spontaneously. It sometimes comes back through an emergency room visit. Most instability occurs in young people, very common under the age of 20, although certain people up to age 30, 35 can have a first-time dislocation. This creates pain, swelling, and a disability time where people don't feel like they can use their knee normally. The concern after a dislocation and the patella being relocated is to try to get the knee back to normal. So we like to emphasize methods to try to decrease swelling, help some with pain, but get motion back and get the muscle moving and doing things and not having a long period of immobilization. We usually discuss some physical therapy, home exercises, and sometimes use some external supports to help the patella to give people confidence to be able to get their motion back and get functioning with their muscle again. One of the concerns with dislocation, of course, is the potential for it to pop out again. This is much more common in young patients than in older patients who maybe have a first-time dislocation. With recurrences, there can be damages that occur to the cartilage or sometimes even a little bit to the bone. So repeat or multiple dislocations we like to try to avoid. Having said that, the first dislocation almost universally is treated conservatively with therapy and attention to the knee. There are occasions where someone may knock out a piece of cartilage and bone that we feel we need to be more aggressive, but most of them are handled in a conservative fashion. Clearly, even without significant damage, repeat dislocations create pain, disability, downtime maybe from a sport, and so are undesirable. And those are things that may push us to try to do a repair to try to keep the patella from coming out. Patella instability is really a bit of a complex issue. Think of the patella like a cart on a roller coaster. If one was descending a steep part of the track and all of a sudden the track got wider, that could be a problem. Conversely, if you went into a big turn and didn't have a bank to help control that cart, that could be a problem. So when we look at patella instability, we have a shape of the patella that helps with stability. We have the shape of the groove that helps with stability. Sometimes patients have a kneecap that's too high, which can be a problem. And there are a whole host of associated issues with leg alignment, muscle, etc., that can make people different one knee to the other on why they might dislocate. So each patient has variations in their own anatomy that can make the patella more likely to dislocate, and there are a lot of variations. Because of that, we need to do a careful exam, radiographs or x-rays, MRI, sometimes even CT scan to really evaluate how that patella sits in the groove and how it moves with motion in the knee to try to decide the most important factors on why that patella is coming out of place. Although there are several different factors, as I mentioned, on why someone might dislocate, a common aspect is that the ligaments on the inside part of the knee, we call it the medial patella femoral ligament, is deficient. So a common part of helping people with recurrent instability is to put a new ligament between the patella and the femur over here, the MPFL or medial patellofemoral ligament, so that when the patella starts to slide out, there is a strong resistance to allowing it to go all the way out and dislocate. Rehabilitation after that procedure, we try to push along quickly. So we typically allow weight bearing. We typically start early range of motion. If we have to address some of the other issues that I mentioned, such as where the patella sits, we may have to modify that a little bit to protect those areas while they heal in addition. So this is a quick video to give you some basic information about patella instability and things that are important with that. We're not exhaustively covering all treatments. We're not exhaustively covering every option in conservative management. Those further details need to be discussed with the surgeon to try to find out what's exactly right for your knee.